So today we are going to start practice of medicine of nervous system. Okay, may important diseases are covered in this class, in the classes of series. Okay, so today we are going to talk about an important class that is facial paralysis. Okay, facial paralysis, or we will also call Bell's palsy. So we will discuss what is facial paralysis and what is the reason behind facial paralysis and what are the clinical symptoms and what are the sign symptoms and what is the treatment in electrohomeopathy. Okay, so facial paralysis, we know that we have 12 cranial nerves. In the 12 cranial nerves which are existing from the crania, so that is the reason we will call cranial nerves. Okay, so in that every nerve have a special function, special area, okay, and special place where they will exit from the brain. So we have facial nerve. Facial nerve is the seventh cranial nerve. Okay, this is the cranial nerve number seven. Okay, and that what will happen? So basically, let's see the uh, nerves function in this image. Okay, so you are able to see this. Well, this is the trigeminal nerve. I want to differentiate. So this is the nerve, facial nerve. Okay, from where it is arriving? So basically, it is arriving from stylomastoid foramen. Okay, so I will show you the picture also. Slido. You can see this is the area called stylomastoid foramen. So here we have one foramen in hole, which one from that area the facial nerve will come. We'll call canal, facial canal. From that the facial nerve will arise. You are able to see that these are the area where the in the brain the facial nerve is arising from that area. It is coming to the whole face. So this is the facial nerve. Okay, from front. So it is going to the uh, anterior part of the head. Okay, here, and it is going to the eyelid, upper eyelid, and it is going to the lips, and it is also going to the cheek region, and here's cheek. Okay, and as well as two third of the uh, face. Okay, you can see that all the places where the you can able to see the picture. So it is coming from that area going to the temporal region, zygomatic region, buccal region, and mandibular region and cervical region. Okay, so this is the seventh cranial nerve. What is the function? The facial nerve is responsible for contraction of muscles of face. So whatever muscles are present in the face, you are able to contract that muscles. Okay, and second is it is supplying to the eyelid also. So in the eyelid, it is going to the gland called lacrimal gland. Okay. So production of tears from the lacrimal gland, it is done by the facial nerve. So one is muscle of contraction, second is for tears. Okay. And if we divide our tongue in three zones, three parts, so two parts are supplied by the facial nerve. Okay. And the sense here, okay, post auricular conchi in the middle ear is also by the facial nerve. So these are the functions of facial nerve. For facial muscles, both side are due to the facial nerve, and tears are due to the facial nerve, and taste from upper two parts of the tongue, and the sensation in the ear. Okay, sense of the ear. These are the three things we have to remember. Okay, so the function of cranial nerve is ended. So these are the area where the cranial nerve is arising. So basically, what will happen? Now come to the point. Okay, so cranial nerve is supplying to the muscles of face, to the eyelid, okay, and to the two-third of tongue, and last is sense in ear, mostly middle ear. Okay, so all this functions from the seventh cranial nerve. Okay, now we will talk about facial paralysis. So what happened? There is any issue or anything happened to the nerve, basically mostly the nerve cell body or axon or dendrites. Okay, in that anything is affected. Okay, if the axon is affected, means we can repair and it will take time. If the cell body is damaged, so it is mostly will take time for repair. Sometimes it will not repair. Okay, so the base upon the area is damaged. Okay, so basically why this is happening? So most of the uh, because when the damage occurs, the nerve impulse will block. So sensation to the face is blocked. So there's the reason the facial muscles, everything will not work properly. So we will see in the image again how why this happens. Most of the people who have hypertension and mostly diabetic peoples are affected because of the high hypertension, diabetes due to the prolonged diabetics, high end of diabetics. Okay, these patients are affected, and sometimes the in the pregnancy also continuous pregnancy will lead to facial palsy also due to the pressure and intracranial pressure also. Okay, so what are the reason? We will know these are the three main persons who will affect by facial palsy. But sometimes causes are there also. We have infection in the middle ear leads to spread this infection near the part of facial nerve. So this is due to the viral infection. Most 70% persons are suffer from with that infection. Okay, and some infection like herpes zoster will also involve. Next is injury. Any injury causing to the post-auricular area or zygomanular notch. Okay, or anything near with this facial nerve will lead to damage of facial nerve. And we have another reason, multiple sclerosis. So we'll talk in multiple sclerosis. So what are the reasons? Any infection. Most of the people have viral infection, and head injury. This is also one of the most common. Okay, these are the two reasons. And other than that, we have hypertension, diabetic, and pregnancy. These are the high risk and patients which will have affect more than this people. Okay, so these are the things. What will happen? What are the clinical features? So I already told you that there is a stylomastoid foramen. Okay, stylomastoid foramen is there, that the branches are coming. So there is the pain in that area. What will tell patient will tell you, I have pain this area, aching, nearly few hours to 150 days. Severe pain. Okay, severe pain is there. Okay, severe pain is there, and after that, the pain will go to the post auricular pain area behind that. Okay, and if it increases, what will happen? The taste, mostly taste, loss of taste is affected because the damage is going in deeper section. Sometimes smell also. Okay, here olfactory not nerve is not involved, but smell also affected, and the patient have continuously tearing from the eyes, excessive tears. These are the initial symptoms arise to the patient. Pain in the stylomastoid foramen or post-auricular ear auricular pain, and continuous tearing and loss of taste and smell. Okay. So these are the clinical features. The patient will tell you about this. So you have to note down all these things. But after that, if the persistently the patient is ignoring that, the damage will increase. Damage of facial nerve increases, and the patient will have other symptoms also. Other symptoms. What are the other than symptoms? He cannot be wrinkled, like wrinkles is coming on the forehead. So no wrinkles on foot, on head or forehead. Okay. And I cannot be completely closed. I cannot be closed completely. If you want to, you have to ask the patient to wrinkle, one side wrinkle will not come. And tell the patient to close the eyes very tightly. He will tell, I am unable to close the eyes. Okay. And what will happen? The jaw will come lower side because of the spasm of the muscles. Okay. So these are the things gradually affect to the patient, and patient is unable to chew the food. Patient unable to hold the food in the mouth. Okay, unable to chew, unable to hold the food. Okay, and the patient, if it is cannot be cured, again the problem will increase. Able to see the deafness. Okay, patient will lead to deafness, tinnitus. Okay, and smell. Already I told you, taste, loss of taste. Everything will be affected. Sometimes, if not treated, entire facial paralysis will happen, complete paralysis, and a patient have continuous uh, mouth frothing from mouth. Okay, saliva will go continuously, and they have continuously tears. Okay, continuously tears. So these are the things are seen gradually how the damage occurs. So initially, unable to, the patient is having pain. If not treated, what will happen? The damage will occur here itself. Wrinkles, eye unable to close the eye, muscles like this like type, unable to chew the food, unable to hold the food in on the mouth, and if not treated, sometimes tinnitus, ringing in the ear, or It may be lead to deafness, and sometimes complete paralysis of face will happen. And lacrimation and frothing from mouth means the saliva is going continuously from the mouth is due to the facial nerve palsy, complete paralysis. Okay, and the patient, if he smile, unable to smile, he will this will come down. Okay, unable to laugh, unable to see the teeth like that. Okay, all these things will happen. And if the end of the facial nerve, the sometimes the eye cannot be reflex. Eye reflexes will also be gone. Okay, why this happening? Because of the complete damage of facial nerve. So we'll see this image. You can see one side of the drooping eyebrow. Okay, eyebrows are dropped. Uh, Eyelid also drop. Okay, okay, and the smell will also go on. These muscles are loosely, and you can observe the difference here. Everything is in place, right place. Everything here on the right side, everything is in a drop position. Okay, so these are the main important things you have to observe. So how can we? Mostly these are the clinical signs. Okay, we can easily understood by seeing the patient. We doesn't need. Sometimes we need tests, sometimes most of the times we doesn't need. If it is mostly high end paralysis, so you can need MRI brain to see which part of the brain is affected. Okay, if the patient have diabetic and the patient is in unconscious state, okay, unable to talk, unable to take anything, diabetic hypertension state, so sometimes you need MRI brain to see which area, which part of the brain is affected. Is either seventh cranial nerve area, or other than that any other part of the area also affected. Okay, so this is the thing. Sometimes nerve nerve conduction test also, nerve conduction study also will do NCS. Okay, to see the damage, how much damage occurs. Okay, NCS of facial nerve, which tells us the damage of how much amount of damage occurs to the nerve. Okay, but most of the doctors prefer, if he doesn't have any clinical conditions like not diabetic hypertension, no other symptoms in the body like unconsciousness, he is talking well. Okay, only symptoms appears on the face. He's walking, he's everything is normal, BP, sugar. So they will count as viral infection mostly. Okay, in the allopathy they will give antiviral medications, along with they will give advice to do physiotherapy. Okay, physiotherapy. So how we will treat in the electropathy? Okay, if the patient having viral infection, can go through CBP or Harper's Zoster test. Okay, ESR also CRP. These are the anti-inflammatory markers. You can see whether the infection is there or not. Okay, if the patient is diabetic, you know how to check the diabetic levels also. If the patient have hypertension, you have to see the liver and kidney functions also. If he is aged, okay, we have to check all this, because how much amount of body is affected we don't. Where is the root cause, we have to know about that. Okay, if you want to treat completely. Okay, and along with that, we have electropathy. We have two to three things are there. Pulse diagnosis. With pulse diagnosis also you can find out which organ is affected. So in that, mostly uh, nerve is related to the brain, is related to the thyroid. Okay, mostly liver. Blood is not properly supplying to the facial nerve or area of the brain. So what we have to do, we have to give stimulant to the nerve. Okay, because they are blood utilizing organs, nerves and brains. Okay, So the nerves are not getting proper nourishment. So we are discussing electrohomeopathy, why the damages occur. So blood and lymph. So we have the principal blood and lymph. So blood is not reaching to the facial nerve area. Due to that reason, the patient have facial palsy. Okay. So proper nourishment is not there. So what we have to do, we have to give nourishment to the facial nerve. Okay. So we have to check the pulse diagnosis. So mostly if they have nerve issues, so properly the nourishment is not going. So we have to treat that area. Okay. If there is no production of blood, so you have to treat liver or bone marrow. So you have to check whether bone marrow is affected or liver is affected. Okay. So let's treat the patient. The nerve is affected. So how we treat the nerve? Okay. So basically we have remedies. Okay. For nerve, we have F1 because it is a sanguine blood temperamental disease. So we'll give the nourishment. We have to give F1A3 because we have to give stimulant. So we will add RE. F1A3 RE. Okay. Here you can add S10 also. Okay, along with S10 F1A3 RE, or else in place of F1 you can add S10 also, because to give metabolism, okay, to increase the uh, metabolism you can add S10. So it will also uh, reach to the nerve. Okay, first initially if it is acute, start with D6, subacute D5, chronic D4. Okay, other than the patient will complain about pain also, we have to improve the symptoms, cause and disease. Three things we have to: pain, cause and disease. All these three are treated, then only we will get particular complete cure. So pain will go when the nerve will work start functioning. Causes, it will take time. Disease also take time. Okay, how much uh, from how much duration the patient have that problem. Okay, so next we have pain. Pain you can give F1 A3 Y, okay, or F1 A3 C5 RE. Okay, you can add in places Y, you can add RE. Okay, okay. So this is the FIP for pain. You can give in D6. Okay, if the pain is high, you have to give rapid dose. Okay, rapid dose in on tongue D6. Okay, 5 to 10 drops on tongue hourly. Okay, till the pain is reduced 30, 40 to 60%. Okay, the pain will reduce gradually, and you have to give the application F2 RE. Okay, F2 for peripheral nerves, it will work very wonderful. Not only peripheral, entire nervous system. RE as a stimulant, and the right side is affected. You have to select RE. Most of the you have to select RE on face nerve. Okay, okay. So we'll select RE, and along with, after, if it doesn't get result proper, you can add S5 also, S5 or C5 or S3, any one, anyone we will select. So these are the formulas. So again, I will tell you S10 A3 RE, and along with C10 when YE. For pain F1, in place of S10 we can start with F1, F1 A3 C5 RE, and have external application F2 RE. So this is in D6. If acute D6 or D5 or D4. This is, I think this is D5 better or D4 better. Okay. Application hot compress. No, you have to give hot compress here. Okay. So these are the basic formula we'll make for trigeminal, sorry, facial palsy. Okay. So we'll discuss next. We have another thing that is trigeminal neuralgia. This is other. What is different between facial palsy and trigeminal neuralgia? We'll discuss. Okay, and we'll how it is can be treated. So any doubts you can ask. And another things, I have to give simple thing here. You can massage also. Okay, you can make the you can add F2RE in the oil. Okay, 30 ml oil, or if you're making D5, 20 drops each, or else D4, 30 drops each. You can add in the olive oil, best in my opinion, and you can shake it and you can give it a massage to the patient. So wherever the facial nerve is coming, branches are coming, so you have to give gently press, massage that area with some pressure. Okay, because the will stimulating the nerve with the help of massage. So reverse impulse will generate and which will give you good relief and which will give best results by this massage. Okay. So I hope you understood about the facial palsy or Bell's palsy. Any questions? Kindly ask.